Good day, sir. I am Nurse Dulce. I will perform cardiovascular assessment. Is it okay with you?
Yes.
Okay, so before we will start, may I know first your complete name and your date of birth?
My name is Gerald Pilos. My date of birth is on February 1.
In doing this assessment, sir, I will touch some areas of your body. Is it okay with you?
Yes.
Are you comfortable right now?
Yes.
The head should be supported on a small pillow. In inspecting the jugular veins, turn the head of the client slightly away from the side of the examiner. Shine a tangential light source onto the neck to increase visualization of pulsation as well as shadows. Palpation. Inspect and palpate the traditional heart landmarks. A right-handed examiner stands at the right side of the client, as well as the left-handed examiner stands out at the left. Pulmonic. It is located at the second intercostal space, left sternal border. Aortic. It is located at the second intercostal space, right sternal border. Erb's point. It is located at the third intercostal space, left sternal border. Tricuspid. It is located in the fourth or fifth intercostal space, left sternal border. Mitral. It is located in the fifth intercostal space, left mid-clavicular line, or also known as the apex. Auscultate for carotid artery. Instruct client to hold breath or slow down respirations while examining heart sounds. Sir, kindly turn your head away from me and then take a deep breath and then exhale slowly. Use bell of stethoscope on the angle of the jaw, the mid-cervical area, the base of the neck. Instruct the client to hold breath briefly. Let the client turn the head slightly to the side not being examined. Okay, sir. Sir, kindly move your head towards me. Use the diaphragm of the stethoscope to auscultate each carotid artery high in the neck, inferior to the angle of the jaw, and medial to the sternocleidomastoid muscle. Ask the client to hold breath for several seconds to decrease tracheal sounds. Palpate the carotid pulses one at a time. Instruct the client to turn the head slightly toward the hand of the examiner to relax the sternocleidomastoid muscle. Sir, can you turn your head towards me? Place the finger pads of your first 2 or 3 fingers on the client's neck, between the trachea and the sternocleidomastoid muscle, just below the angle of the jaw. Palpate firmly, but not so hard that you occlude the artery. Palpate one side of the neck at a time to prevent the carotid sinus reflex on the carotid artery. Transfer sides and do the same. Sir, can you turn your head away from me? Note the rate, rhythm, amplitude, contour, and symmetry of the carotid pulses. Compare this rate to the apical pulse. Lightly palpate the precordium. Ask client to exhale fully and hold it for a few seconds. Sir, kindly take a deep breath and then hold it for a few seconds. Locate the apex and initially use the palm of the hand to locate the apical impulse. Then use one finger pad for more accurate palpation. Palpate the apex, left sternal border, and base of the heart. Note location, strength of apical impulse. Palpation of the precordium of a female client is best done by placing the palm of your right hand directly beneath the client's left breast, such that the edge of your index finger rests against the inferior surface of the breast. Make sure that you tell the client what you are about to do and why before actually performing this maneuver. Auscultation. Always warm stethoscope before auscultation. Remember to use the diaphragm of the stethoscope for high-frequency heart sounds and the bell for low-frequency heart sounds. Auscultate for heart sounds. Position the client in left side lying. Ask the client to roll to the left side as you auscultate using the bell of the stethoscope. Sir, kindly turn to your left. Note rate, rhythm, and location. Listen at the apex when at the left side lying with breath held in exhalation. Use firm pressure on the diaphragm and light pressure on the bell. Another way to assess the heart sound is to position the client in a sitting and leaning forward position. Sir, kindly sit down and then lean forward. Listen down left sternal border to the apex when sitting or leaning forward with breath held in exhalation. Note rate, rhythm, and location. Use firm pressure on the diaphragm and light pressure on the bell. Auscultate the traditional heart landmarks and listen using the diaphragm of the stethoscope. Instruct client to hold breath or slow down respirations while examining heart sounds. Note for rate and rhythm. Pulmonic. Second intercostal space, left sternal border. Aortic. Second intercostal space, right sternal border. Erb's point. Third intercostal space, left sternal border. Tricuspid. Fourth or fifth intercostal space, left sternal border. Mitral. Fifth intercostal space, left mid-clavicular line, or also known as the apex. Count the apical pulse for 1 full minute. Note for rate and rhythm. Special test. Assessing for hepatojugular reflux. Position client in supine. Instruct the client to turn to the side away the examiner and use tangential light. Then instruct the client to breathe through an open mouth.
Okay, sir, kindly turn your head away from me, and then all you have to do, you breathe normally with an open mouth.
Hold your right hand on the right upper quadrant of the client's abdomen just below the rib cage. Watch the level of the jugular pulsation or distension as you push in with your hand. Exert firm, sustained pressure for 30 to 60 seconds.
Are you in pain, sir?
No.
Checking for pulse deficit. First, auscultate the apex of the heart, holding the stethoscope in place with the hand that holds the watch, and then palpate the radial artery with the other hand. Take the pulse for 1 full minute. You can feel any discrepancies between the apical and radial pulses. If the radial pulse is lower than the apical, the difference is called the pulse deficit. Peripheral circulation assessment. Position the client in a sitting position, dangling in bed. Stand in front of the client. Check, palpate, and compare the skin color, venous pattern, temperature, lesions, ulcer, and edema to the upper and lower extremities. Note color pigmentation, continuity, hair distribution, edema, vascularity, venous pattern, lesions, and ulcers. Position client in supine position and locate the different peripheral pulses using the index and middle finger to identify, palpate, and grade amplitude of peripheral pulses. Palpate peripheral pulses bilaterally and note for rate, rhythm, symmetry, and amplitude or strength of the beat, which are graded from 0 to 4. Temporal pulse at the anterior to the ear. Carotid pulse at the right or left of the trachea, anterior to the sternocleidomastoid muscle. Palpate one at a time. Brachial pulse in the antecubital at the inner aspect of the bicep muscles of the arms. Radial pulse on the thumb side of the wrist. Place client's forearm along body or across lower chest or upper abdomen with wrist extended straight. Ulnar pulse on the inner surface of the wrists. Femoral pulse at the left or right middle of the groin. Femoral pulse at the left or right middle of the groin. Popliteal pulse at the posterior surface of the knee. Lift up the lower leg. Try to slightly straighten the client's leg and palpate. Often, a normal popliteal pulse is impossible to palpate. Palpate one at a time. Dorsalis pedis pulse, located at the posterior surface of the foot. Plantar flexing the foot may make pedal pulse easier to palpate. Posterior tibial pulse on the lateral surface of the ankle. Passive dorsiflexion of the foot makes the posterior tibial pulse easier to palpate. determines the patency of the radial and ulnar arteries. Ask the client to rest the hand palm side up on the examination table and make a tight fist. Occlude both radial and ulnar arteries with your thumb. Ask client to open hand into a relaxed, slightly flexed position. First, release the pressure over the radial. Repeat releasing the other artery, the ulnar artery.
Okay, sir, kindly make a fist. And then, kindly open your palm.
Burgers or color change test. Place client in supine position. Raise both legs to approximately 60 degrees for about 1 minute. Instruct the client to pump the feet up and down or wag the feet for about a minute to drain the legs of venous blood, leaving only arterial blood to color the legs. Then ask the client to sit up with legs dangling down. Trendelenburg test. This test is used to evaluate valve competence in the presence of varicosities. Position client in a supine position. Elevate the legs to a 90 degree until the venous blood has drained from the leg. Place a tourniquet around the upper thigh. Help the client to stand. After the client has been standing for 30 to 50 seconds, remove the tourniquet. Note of feeling of venous system. Capillary refill test. Hold client's hand, then quickly press on the client's fingernail with your finger and count how long it takes for the skin color to return to normal. Apply 5 seconds of pressure to the client's fingernail and toenail between your fingers, sufficiently to cause blanching. Release the pressure and observe how quickly normal color returns. Test for Homan sign. Position client in supine position. Flex the client's knee about 5 degrees. Now sharply dorsiflex the client's foot. Ask whether the client feels cuff pain.
Are you in pain?
No.
Are you in pain?
No.
Edema. Check for the presence of edema by using the tips of your fingers. Press the skin of the client for at least 5 seconds over the tibia, behind the medial malleolus, and over the dorsum of each foot. you.